Hey everybody. I know there's been a lot of information going around on the effectiveness of masks versus the non-effectiveness of masks. So I kind of wanted to do a little bit of research for myself. Um, I went online and I found a bunch of articles of researchers that I thought were very interesting, and I wanted to share some facts with you. I have a list of information that I found, and I'm just going to be reading from the paper just for uh, clairvoyancy and just to keep on topic, because I get it from my father, but we tend to get sidetracked a lot. So I just wanted to read this to you. I entitled it "Truths Behind the Mask." Um, to begin my study, I started reading a comprehensive review by a man named Paul Hunter, a professor of medicine at the University of East Anglia, United Kingdom, and his colleagues on 31 published studies of the efficacy of face masks. Their review was based off studies on medical grade, also known as surgical paper masks. Just a side note, on April 2nd, 2020, the CDC, which is the Center for Disease Control, stated that the cloth face coverings recommended are not surgical masks. So they're not the paper masks that we're going to look at, or the N95 respirators. These are critical supplies, and I'm still quoting the CDC, that must continue to be reserved for healthcare workers and other medical first responders. Those surgical masks referenced by the CDC are those same surgical paper masks that the study was done on by Paul Hunter and colleagues that we'll get into in a second. Onto the study. After the data was compiled by Paul Hunter on paper mask effectiveness against flu-like illness, which is what COVID is, they determined that, and I quote, "Wearing a face mask may very slightly reduce the odds of developing respiratory symptoms with low certainty evidence." Let me repeat that. Wearing a face mask may very slightly reduce, and this is a quote, may very slightly reduce the odds of developing respiratory symptoms with low certainty evidence. Low certainty evidence is defined as such that investigators have very little confidence that the effect of the study is close to the true effect that they were studying. That means that even with the result of the study being slightly effective, in this instance, they found that it was with low certainty, 6% prevention if all parties are wearing surgical paper masks. And I keep saying surgical paper masks because we will get into the effectiveness of surgical paper masks versus cloth masks that the CDC and the WHO are recommending that we use. The investigators have no confidence that even that data, the 6%, is true. Moving on from surgical paper masks to those cloth masks that the WHO and CDC urge us to wear to save the better masks for medical personnel, we dive into a study done in 2015 by a woman named Professor Raina McIntyre, and I'm sorry if I mispronounce things, and her colleagues at the University of New South Wales in Sydney in 2015. And in 2015, we had an outbreak, Ebola, if you remember, and I'm sure you do. In this study, Raina and company pitted those same paper surgical masks talked about in the study by Paul Hunter against cloth masks. Those same cloth masks that the CDC and WHO recommend. And I very loosely say recommend because apparently recommendations have turned into some arresting and some enforcement. And anyway, I'll say recommend, but I usually I loosely use that that word. Anyway, they say we shouldn't wear better masks than cloth masks to save it for medical personnel and people working in the healthcare industry. Participants in hospital wards in this study done by Raina, or the workers, were randomly assigned either medical grade paper masks or cloth masks and were made to wear them on every shift that they worked for a 4-week period. The outcome of the study is as follows, and this isn't my personal opinion, any of this. These are studies that you can find on the internet if you Google it, and these are independent studies by these people. The rates of all infectious outcomes were highest in the cloth mask arm, specifically the ILI, which is the influenza-like illness. The rate of illness was significantly higher in ILI in the cloth mask arm, COVID being in that category. Penetration of particles approached 97% in cloth masks, and medical masks were penetrated at about 44%. Even with a penetration significantly less than that of the cloth masks, Paul Hunter still only found paper medical masks, those 44% penetration as opposed to 97% for cloth masks. He found them to be 6% effective, without even having confidence in that number. Remember, he had a low certainty evidence, is what was stated. So, let's not forget also that he stated that even the medical paper mask may very slightly reduce the odds of developing ILI. May very slightly, and that's a quote. The conclusion of Reyna's study was this: there was a caution against the use of cloth masks. And I quote, moisture retention, reuse of cloth masks. And when we talk about reuse, we're not talking about it on a day-to-day basis. She talks about how moisture, which happens very soon after, inhaling, exhaling, you're always exhaling moisture. So that happens very quickly. The reuse is not just day to day, but after the mask is touched, and you see people all the time touching and pulling them up, pulling them down, reusing them from store to store when the mask gets moist. Everybody reuses those masks, not just on a day-to-day basis. And poor filtration may result in increased risk of infection. This is all still a quote. Cloth masks should not be recommended, particularly in high-risk situations. Now, I want all of you to tell me one thing in conclusion. What is being made into more of a high-risk situation than this COVID outbreak? The world is literally on shutdown. So her study found in 2015, when referring to Ebola, applies just as much with this COVID outbreak. So her recommendation and the studies, the data, the facts that have been found by her and Paul Hunter prove that even with a mask that we are being recommended not to use, it's only loosely 6% effective if all parties wear the mask. But with these cloth masks, with the 97% penetration as opposed to the 44%, it's doing us no good. And those are the facts. You can argue, and people argue, do what's best for your fellow man. Well, what's best for your fellow man is washing your hands, is being cautious in any situation in which there's a communicable disease or illness. It's not fear-mongering people into wearing something that's actually causing more problems than not, getting yelled at for going into stores without wearing a mask, which stores have the right to tell you not to wear a mask. It's private property. But the government is fear-mongering people into thinking that this is actually helping, when it said it's just causing mass panic and hysteria. And in many cases, even in China, with those kids dying while running wearing face masks, it's causing more harm than good. So I urge all of you not to believe everything that you hear, but to do your own independent research and realize that basic, proper hygiene and just critical thinking skills are going to help you a lot more than government fear-mongering.